Hello out there in television land. Welcome to yet another edition of It's Your Health. Philip Benyo with my bride, Kathleen, and my dear bride. Tell us about that brooch.
Oh, I love this brooch. My husband, my wonderful husband, got this for me. It's an antique, and I love animals, so
I'm an animal
perfect.
and an antique, so there you go. We'll be right back after this brief commercial message. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. Right, sweetheart?
We have a lot to tell you.
All right, we'll be right back.
Welcome back to the first part of our show, and I love this cartoon, this Charlie Brown, and it's so true. Summer runs and winter walks. But the good thing about winter is then we get fall and the leaves, and then we get winter and snow and Christmas. And that means presents.
Well, I shouldn't announce this, but I'm going to, for Christmas, sweetheart, take you to a place you've never been before.
Oh, I don't know where my passport is.
Sweetheart, it's called the kitchen, okay? That's where we're going to...
Here we go again.
All right, moving right along.
All right. I'm going to do a headline instead.
Okay.
Farxiga, and it significantly reduces the risk of hospitalization among patients with chronic kidney disease. And the range of positive benefits from this includes reduced risk of mortality and cardiovascular events and kidney issues. Wow.
Well, when Farxiga first came out, of course, it was for diabetes. And we're now finding that it reduces heart disease risks, heart failure, for example, and preserves kidney function. So I actually see cardiologists and nephrologists putting patients who are not even a diabetic on Farxiga for that reason. So it's, again, a nice side effect, if you will, of a medication.
Well, a lot of medications have done that. They've been used for one thing and then discover that they could help with other things.
No doubt.
Okay, this one surprised me. Less than a third of Americans aware of the cancer risk from alcohol. It doesn't matter too much what kind of drink it is, whether it's whiskey or a bourbon or wine or whatever, but all types of alcohol, especially we don't think of it as wine, increase our cancer risk. It is expected that the Surgeon General is going to put something on all of the stuff that we get that's alcoholic, that is going to say consumption of alcoholic beverages can cause cancer, including breast and colon cancer. And they expect that to happen on all of them?
Just like on a pack of cigarettes. That's bad news, I think. That's very bad news. But that's because
terrible.
Who doesn't
I never expected it.
Who doesn't like to have a little nightcap or, I always kind of thought red wine was good for you, but I guess for every reward there's a penalty.
You know, it depends. It depends what month you're in. You know, one month something's not good, the next month it's fine. Our newest booster vaccines may ease long COVID. Long COVID patients should get the latest boosters, especially as there's no evidence they are unsafe for them. So that's an important thing to know. A booster dose could help rev up the immune response in a patient with long COVID.
Yeah, well, long COVID is an issue out there in television land. We see it all the time. People who may have some cognitive impairment or worse after a COVID-19 infection. If you have underlying lung disease, you have cough and shortness of breath. So anything to reduce the risk of COVID and COVID long hauler is certainly a benefit. We're going to talk a little bit later on in the future segments about COVID-19 vaccinations, and I'm going to test my bride for COVID.
Oh, that's really funny.
Okay, you'll have to wait.
I don't want to do that. Okay, let's instead talk about health benefits of apples.
Well, there you see a picture of my old office.
Oh,
The
yeah.
entrance, which is apple and a stethoscope around it.
That was so everybody could find their way there.
Yeah, well, an apple a day keeps the doctor away, right?
Well, there are all different kinds of apples of all different colors, and Europeans brought the apples to America because they didn't like the little tiny apples that they found here. And the most important thing I found was that apples are loaded with fiber, but especially their skin. That's the part we throw away, and that has the most fiber. So I don't know how I'm going to make my apple pies if I have to let the skin on.
Sweetheart, we base this program on truth and the American way. We're not going to have apple pie this year, I can guarantee you that.
We didn't have it last year either.
All righty, moving right along.
Okay. And study says Mom was right. Eat your vegetables and live longer. Eating fats from plants compared to fats from animals affect how long people live. Researchers found what we already suspected. A diet higher in fruit, vegetable, green, and plant-based oils like olive oil offer better protection against death from all causes and diseases of the heart and the blood vessel. And how much you consume matters too. People who consume more fat from plants had a 9% lower risk of death from all causes. Here's the part that surprised me. Took my breath away.
I thought I'd do that.
No.
All right.
Okay. Buy your green beans, your mangoes, whatever, but buy them frozen, because the frozen vegetables and fruit are packed with the best nutrition and have more vitamins and minerals than any of the fresh ones.
It's hard to believe. Just watch out, because frozen food sometimes has a higher sodium intake. But fruits and vegetables, the less you get away with processed foods, you move away from those and eat the stuff that's closer to the ground, you're going to be better off.
Fat from red meat carried a much higher mortality rate. Anything else you want to know that I can tell you?
No, it's time to take our first break, sweetheart. Is that okay?
Since when do you ask me my opinion?
We'll be right back after this brief commercial message. You're watching It's Your Health. Please call our sponsors and tell them you heard it on It's Your Health, and better yet, utilize their services. Right, sweetheart?
Right, no, that's right.
Okay, we'll be right back. Welcome back to the second segment of It's Your Health. I'm still with my bride.
What?
Can't hear us, huh?
What? I like this cartoon. She's saying to him, I think you need a hearing test. And his answer is, what do I need a hairy chest for?
And that goes into our first headline, correct?
Unfortunately, it's about falls and death in dual sensory impairment. In other words, vision and hearing impairment in patients older than 65 may be associated with an increased mortality risk. Compared with non-impaired individuals, there was a higher risk of death in the vision and the hearing impaired people.
Right. Well, if you can't hear, that puts you at risk for falling and bad things. If you can't see, same thing. So 1 + 1 = 3. You can end up getting a double whammy from these things. And it illustrates the fact that out there in television land, you need to get your eyes checked and your hearing checked.
You forgot one.
I did?
And you need to see the dentist.
Oh, okay. Yes, that's true.
Yes.
I'm sorry. Thank you
Because
for...
gum disease is very dangerous.
No doubt.
Okay. Ha ha. I got him on that one. All right, here we go to Veoza. It's a non-hormonal medication labeled for the treatment of moderate to severe vasomotor symptoms of menopause. But it does have an effect on your liver function, and you should have a baseline liver function test done when you start, and then continue to have the liver test done. It's well handled and tolerated, but it's less effective than hormone.
Well, we're not really using, hormonal therapy for postmenopause, if you will, because of their risks factors. So it looks like you're going to suffer with your hot flashes, sweetheart.
I know. I wake you up about 2 in the morning and say, I'm roasting.
I guess I'm the one that's suffering, not you.
Yeah, that happens. Okay. Post-traumatic stress disorder, PTSD. Is there a way to reduce symptoms in adults? It's characterized by complex behavioral, somatic, and cognitive effects caused by a traumatic event. They recommend fluoxetine. Forgive me if I don't pronounce it right. I don't want your forgiveness. Paroxetine and sertraline.
Prozac, Paxil, and Zoloft. So.
Yeah, that's what I was going to say.
All right. You've been waiting for this. We're going to test you for COVID. All right. Now, what you do is in this kit, you're going to have a...
All that stuff is in there?
Yes. And by the way, you need to get an up-to-date kit. A lot of people out there have kits that are expired and they're going to be inaccurate. So you get this swab that comes with it, and you go up your nose 5 times going like this, or 15 seconds, then you go up the other side, and you just can't do the tip. You got to get in there.
And roll it around.
Roll it around, right. 5 times, 15 seconds. So it then goes into this handy dandy that has the water or solution in the, looks like water, but it's a thing where you go like that and you do it again 5 times to get the virus into the eloquent, the juice, if you will, and take this out, and there's a top that goes on this. And you go like that a few times to shake it around. You then take 3 drops and drop it onto this handy dandy developer.
Which you keep flat and don't put near water.
Right, and the C stands for control. So she had a positive control, which means the medicine that's developed in there worked. And of course the test was negative. So if you got double lines, you got COVID. And give us a call then.
Yeah, and it's no fun having to take that.
No, I agree. So we're going to talk a little bit more now about vaccines. We're going to try to run through these. They're sort of complicated, but we're going to try to make it easy. And again, check with your healthcare provider.
Okay, people who are immunocompromised, you may get additional doses of updated COVID-19 vaccine 2 or more months after their last vaccine.
So the COVID-19 shots are now available. You can get it with your flu shot, by the way. And the next vaccine that we're going to be talking about is RSV. What can you tell us about that, sweetheart?
Well, before I tell you about that, I do want to tell you that the one that we are talking about is okay for people who are pregnant or breastfeeding, that's okay. And you need to go to either a pharmacy, right, or to your doctor.
Yeah, we have it.
And you need an appointment. You don't just walk in for it.
So RSV, respiratory syncytial virus, had been seen in kids several years ago, but now it's morphed into an dangerous adult disease, and there's a vaccine for it.
Yes, it's licensed by the U.S. Food and Drug Administration for a use in adults 60 and older. And all adults age 75 and older should get it.
So we don't really have that in the office. I don't think we do. Maybe we'll get it in the future. This is something that you would call your pharmacist for and make an appointment for. And then moving right along, we of course are ready to get the flu vaccine, correct?
Oh yeah, and can you get them both at the same time?
You can get flu and COVID at the same time. Generally the same side effect warning, a sore arm, you might have flu-like symptoms. We haven't seen any, bad reactions from that. So
one thing that surprised me is if you're 6 months old, you should get the flu vaccine.
I don't think they're watching It's Your Health, sweetheart.
But they might have parents who are watching.
Then they have smart parents.
That's my whole point.
Right, and then last but not least, we're going to talk about bacterial pneumonias, and the far leading candidate for that is pneumococcal pneumonia. Very serious bacterial infection, and there's a vaccine for that called pneumococcal vaccine. And it's kind of a tough roadmap to watch here because there's 3 different vaccines available. Some of them depend on whether you have had it in the past or have had another type of pneumococcal vaccine. So there's a sort of a Chinese menu that we watch. It looks a little complicated.
Is this a virus or a bacteria?
No, it's not a virus, it's a bacteria.
Okay.
And so there's a list of the permutations and types of vaccines we would offer to you depending on your age, whether your prior vaccine was done with either of the 20 or 23. So you just have to follow this, but we have it in our office because it can get complicated sometimes.
And it's important, it goes back to the same organization of young children and elderly adults are the most susceptible to this, just like with all the others.
Right, and so again, it deals with immunity. So that was a quick synopsis of vaccines for viruses and pneumonia. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health.
I couldn't even turn the pages fast enough.
Welcome back to the third segment. What does that mean, by the way?
Behind every husband who thinks he wears the pants, and I happen to be sitting by one of them, is a wife who told him which pants to wear.
You know, folks, when I married Mrs. Wright, I didn't know her first name was Always. So
you're lucky to have me to dress you. Heaven forbid what you would look like going to work.
Moving right along.
Oh, this is a tough one. Geriatrician shortage. The baby boom has become a senior surge, a growing pool of aging patients for geriatricians to treat. Their number is expected to hit 73 million within 5 years. And I won't go on from there, but we are not getting doctors to become geriatricians. You are a dying breed. You are a dinosaur.
Oh, well, more ways than one. Well, there are certain commandments. You don't have to be a geriatrician to know these in treating the elderly.
But you should.
There is no pill for every ill, and sometimes less is more. And try not to treat side effects of drugs with more drugs.
So one of the problems that you sometimes observe when you see patients for the first time is that they're on too many drugs.
Too many drugs, too many drugs. After 5 drugs, they start interacting with each other and you. So again, less is more.
improvement in both depressive symptoms and cognitive performance in patients with depression and dementia, and adds to the research that these clinical effects also extend to improvement in health-related quality of life and patients' daily functioning. And what kind of what kind of medicine are we talking about?
Right. You're generally seeing patients with dementia have depression, and if you treat the depression, their cognition may improve. So it's one of the depressive medications. Try to come up with something with the least amount of side effects.
Well, you know, if you treat depression, a lot of things improve.
There's no doubt. No
Yeah.
doubt.
Ask knee patients about stair climbing difficulty. If a patient has osteoarthritis, the first thing you do is ask them, can you climb the stairs? And their difficulty in climbing gives you your answers, don't they?
It's one of the first symptoms of knee osteoarthritis that you're going to be heading into trouble. Are steps an issue?
Slow gait speed has been linked with mortality. Stair climbing difficulty is often the first reported limitation. So you sometimes see people walking around and they are really walking slowly. But there's a reason for that, and it's a serious reason.
Right. You're looking at a knee replacement.
Oh, and you can only get one, right? You can't be like Elton John and get both at the same time.
I'm not sure how that works.
All right. Okay. You want to hear about tonsils?
Well, this is not exactly a tonsil. It's a picture of something that's stuck in the tonsil. For example, the tonsils are like English muffins. They have nooks and crannies, and things can get stuck, and we called it a tonsillith.
Yeah.
And in the olden days, I used to get a tongue depressor and kind of just fish them out because that's kind of junky back there. So some of those who have that, sometimes saltwater goggles will do the same thing.
Recurrent sore throat, halitosis, the feeling that there's a foreign body in your throat, and hoarseness.
Right. So it's something to look at.
I never even knew that. I mean, I remember, well, I sort of remember getting my tonsils out, but I was extremely young when I got my tonsils out. We're going to talk about gallstones now.
Gallstones, pretty common out there in television land. We see it. I used to learn about gallstones by learning F's of gallbladder disease. Female, 40, fertile, fat, family. So those are the kind of things, and they get flatulent. You get gas and pain
That's
after
another F.
That's another F. So gallstone disease is out there in television land. There's a list of the risks that you can have with gallstones. With all this weight loss going on, we're seeing a lot more gallbladder disease as well.
10 to 15% of adults have it, and the most common one is the cholesterol gallstone.
Correct.
Scientific theories for healthy aging. This is an easy one. See your doctor for regular checkups. That's him. See your dentist. We now have lots of proof that if your gums bleed, that's just not accidental. That means something else is going on, and that's bad. And see your eye doctor. Here are some things that they might look for.
It sounds so simple, but and it is. Cholesterol levels, high blood pressure, get your colon checked with a colonoscopy, up-to-date GYN exam, mammograms, and so get tested for osteoporosis with a DEXA scan. Stop smoking, limit alcohol, we just found out. So it is kind of simple stuff to maintain health, right?
You know, the colonoscopy isn't simple, but I can tell you people who have passed away because they went ahead and didn't take the...
I know.
Oh, the most important drugs that were ever invented and have made a difference in the world are listed here. And I think the most important one is aspirin.
Well, it's
Because I get headaches a lot.
Oh, don't I know that? You got to get up with a better excuse than, I have a headache tonight, dear, okay? You got to come up with something different. Let's close on W.C. Fields and what he suffered from called rosacea. There's a picture of this skin disorder, kind of a pimply thing involving the nose and face. Topical agents are useful. Sometimes they require antibiotic therapy or stronger medications. But rosacea is out there. And again, you'll see some of the triggers for rosacea. If you're out there suffering, you need to avoid what's on that list.
I want to say thank you to all the people who stop me and say, I watch your show and I love when you pick on your husband.
Is that right?
So for those of you who do that, thank you so much.
Listen, life imitates art. That's exactly what happens at home. I get picked on a lot. So thank you for joining us and allowing us to come in your home, inform and entertain you. And make sure you check with your healthcare provider and call our sponsors and say, thank you, I heard it on It's Your Health.
Absolutely.
Anything else, sweetheart?
Yeah, thank you, Sammy. We love him.